the Mint Door Podcast with Dr. Karen Tyndall and Dr. Laura Schwint. Are you tired of the burnout cycle? It is time to serve sustainably without sacrificing your well-being. The Mint Door's Elite Performance Coaching can help you cultivate a holistic approach to your well-being, enhance your leadership and self-mastery skills, and optimize your life for successful personal and professional fulfillment.
Don't put your true best self potential on hold any longer. Begin now by scheduling a complimentary Minty Moment impact chat and embody your radiance today. But now, welcome to the show. Today on the Mint Door podcast, we're thrilled to introduce Dr. Atousa Safavi, a true visionary in dentistry. Dr. Safavi, a DDS graduate from the University of North Carolina Adams School of Dentistry, leads Claremont Dental and Aligned Healing in Denver, Colorado. She specializes in biological dentistry, focusing on safe amalgam removal, cosmetic dentistry, sleep apnea, and TMJ disorders. What truly sets her apart are her unique healing tools, clinical hypnosis, body code, and emotion code.
Sounds fascinating. She's an adjunct clinical professor at CU School of Dental Medicine, and Dr. Safavi is also an approved consultant in clinical hypnosis, recognized with awards from the American Society of Clinical Hypnosis, and her innovative approach bridges oral health with holistic well-being. So get ready to be inspired by Dr. Atousa Safavi. Well, welcome, listeners, to another episode of the Mint Door podcast, where today we are honored and excited to bring you Dr. Atousa Safavi. Atousa, thank you so much for coming on to talk to us today. We can't wait. You have such a fun background, and listeners, just know that there is going to be some golden information in this podcast. So thank you so much, Atousa, for being here.
Oh, thank you so much, Laura and Karen, for inviting me. It's such an honor to be invited and being on your podcast and having a wonderful conversation hopefully today.
Fantastic.
Well, we're super excited to go behind the mask today and uncover a bit about you. And our first question, and we ask this to all our guests on our Behind the Mask podcast, is tell us a little bit about what insecurities that you may have hidden behind your professional mask over the course of your life.
Well, that is an amazing question. Yes, I remember that especially when I graduated, I had this feeling of, and it's interesting that you mentioned this, that I had this dream that I was in the middle of a procedure. And as I was doing this procedure, I was worried. I think it was a veneer or it was a little bit of a complex procedure as a new grad that you feel insecure about, right? And then suddenly I heard that you know enough. And it's so interesting when I heard that and I paused. I remember then waking up from the dream thinking, oh my God, those are all my insecurities that do I know enough? Coming out and knowing how to do all these things and all the things that I need to know. And as I'm sure both of you being seasoned dentists, we knew barely nothing. Even now, after being in dentistry for so long, I still feel I don't know enough, but just hearing that word and knowing that, yes, I know enough, I care enough, I can get through this. School is not all about learning everything. It's just not possible. So over the years, I learned that I just need to be open and be in tuned in that moment with my patient and trusting that I'll get through this because I care enough, I know enough, and I have learned to become a critical learner from school and I have resources. I am connected to all these amazing other, colleagues that I can ask, and it's okay. So I think that was a huge part of my insecurity, that if I got this, and as a woman, do I need to show myself as a boss a certain way? Do I have to present myself as when I was asked to give a talk on hypnosis, because hypnosis is one of my passions, that I was I learned how to do hypnosis, and I was able to go through dental school because of that, and it probably helped me with all those insecurities that I was feeling. That do I have all of this? And I think that helped me a lot to be able to say, no, I'm connected to the source. I'm connected to, a lot of people, and um, I can do this. So yes, I think daily I have to remind myself of all the insecurities that come, and I think reframing, um, changing those insecurities has really helped me as well. So when the thoughts come in, just say, thinking about it and reflecting on it, and saying thank you for reminding me that. So maybe I should learn, or know more about something, but then knowing that's okay. All of these insecurities are present and everybody has it. It's just how we deal with it probably helps us through every day. I hope
I
I
mean,
answered that question.
you certainly did, and I think at this point we could drop the mic, and that would be good because everything that you have just said, and as you're saying that, I'm like, as as a dental student, to listen to this, that advice is incredible. As a newly qualified dental student or newly qualified dentist, wow. And for even those people who've been in the profession for a long time, it just shows that we're all feeling the same, but with that mask on, we're hiding it. So have you shared that message with younger dentists?
I
Have you?
have not. I have not. And if there is a young dentist listening to this, I'm privileged now that I'm having this opportunity to do that, because I think our profession is such a lonely profession. And I think a lot of women are trying to change that. Like, I'm part of a mommy dentist. We are part of Do. A lot of women, I think, are seeking out. And actually, there is another male dentist that now they're doing that for their group, seeing how successful we are, reaching out and connecting. And it's incredible how everybody thinks being lonely, they think these are my thoughts, these are only my insecurities, and everybody else got it. And looking around, especially for me, I was a public health dentist and I was in the university for years. So I think that kind of gives you a fake, cushion and security that, you are in that environment. It's a sterile environment. Just a different setting. And
Mhm.
then when I came in the private sector, I just felt, well, I'm not a good business person. I'm not a good this or that, or I'm not a good leader. All these labels that I kept giving myself versus knowing, and if you're, a recent grad or a dental student, knowing all of those are skills. All you have to do is learn them. Nobody was born with them. So, so knowing that you just need to know the right class or the right mentor or the right person that is willing to say, yes, that's exactly what I did, and that worked. And I did the XYZ and it didn't work. And I finally found what it works for me. And when it works for me doesn't necessarily mean it will work for you. And that doesn't make you a good clinician or a bad clinician. It's just a different clinician. So
So valuable. Thank you for saying that out loud, because I think that in our profession, we're often, and that's why we call this behind the mask, is that in our profession, we're often wanting to display that we have it all together, that we know it all and everything is perfect, right?
yes, for
And yet,
sure.
but behind that mask, we don't feel that way all the time. And I love what you said. And I think you should make a poster of this, but that I know enough and I care enough. I think those two pieces, like if you could remind your younger self that, right?
Absolutely.
Keep
It's
that.
so lovely to hear it from you. So, see, that's the thing, like hearing it from somebody else and saying that to yourself, those are just so important. Thank you for that.
Mhm. Yeah. And so carrying that through your life, How has that shaped where you are today?
Um, and that has given me the confidence and the boldness to try new things because I have always struggled with making decisions. And it took me a long time as I mentioned, hypnosis has been a true gift for me because the word enough that I heard for the first time that I was under hypnosis, that was the first time I heard. And when I give that message, I try every time when I have a client, when with a patient that I'm working with, I say that word. And it's incredible that it's just we need to hear it on a subconscious level, not just on a conscious level, because we think that yes, maybe I'm enough, but we need to hear it. Our cells need to hear it that we got this. And so I making decisions have always I'm a first child. I'm a recovering perfectionist. So so I never like to make mistakes. And so just knowing, I think it truly was after hearing the word enough and knowing enough and seeing that dream and all of that was that, okay, a decision doesn't have to be a perfect decision, it needs to be a decision. Then as I go, I learn. There is um, there's a miracle in boldness. So as we go through it, as I make that decision and I go through it, then I figure it out. And that has been a huge pivot, I would say, in my career as a mother. I have twin girls that, I became a mom instantly at once, right? There's a lot of insecurities as a mom. So, am I doing things right? And again, having another female friend of mine who's a pediatrician helped me. So I feel as women, we have the gift of age. I have to credit my age for knowing that because as women, I think as at least for me, as I age with my culture background, with so many things, just knowing that okay, a decision doesn't have to be the first decision doesn't have to be a perfect decision. It's a decision. Then I can see where I am. And also learning to pivot. I can't remember from which summit or seminar that I went that the speaker said, you need to pivot every 3 months. You need to pivot and see if you did something. And if it's working, okay, great, continue. If it doesn't, then pivot to something else. And I think that has taken a lot of anxiety and insecurities out of my decision that, okay, well, it's not end of the world. It's not a death sentence. I can make a decision and pivot and see, okay, did that work? Did that not work? And I made the best decision in that moment. And because there's again a lot of judgment, I think that we put on, at least I speaking for myself, I would put on myself that I wish you would have looked at this or would have connected with the right people. Well, I did the best I could at that moment. And then if it wasn't the right one, I'm going to pivot. And that's okay.
It's it makes me think. I heard something, and it's interesting. You hear something and it changes the way that you think. Um, and for me, hearing something, and I heard it really recently, and it was a really good reminder along the same lines as that. You don't need to know the whole journey. You just need to know how to take the first step. And I think that's also something that age teaches you is that when you're younger, you think that you need to have everything planned out. And as long as you know the first step, then that comes into your pivot that you then just, it's each step is a pivot,
Absolutely. Oh,
isn't
that
it?
was beautiful.
Yeah, I love what you said about that. It kind of really it just it tied those two ideas together. But I mean, over the course of your career and your dental journey, you've done some interesting training and education, and you have a very diverse set of skills. Um, Over the course of that training, are there any experiences that you can think of that really shaped the sort of holistic patient care that you provide?
I would say my own healing probably shaped where I am because I had to. So, a lot of things that you see that on my resume, it's things that I had to figure out for myself. So, I got into, you know, I would go to to find for my own health issues and different things. For example, I got into hypnosis because of,
Mhm.
my test anxieties and stage frights and different things. And then I got into holistic approach for my health because Western medicine wasn't answering my my issues, and they diagnosed me and put me on a medicine, and I'm extremely sensitive to medicine. So I took a huge dive on my kids were recent, they were twins and they were little, and I of course decided to go back to school and all the things that I had on my plate, and really wanting to find. And there was someone that told me, you need to search in holistic alternative medicine near you. And I Googled, and sure enough, I found a really famous guy behind literally 15 minutes from my house. And I had no idea. And so I go to see him, and he was an MD that became an alternative medicine trained, and he looked at all my things and he was like, "Oh my gosh, you're on all the right and wrong things." And then he switched everything, and then he realized that actually a lot of my issues were from heavy metal exposure. And so I just learned so much from trying to figure out answers for me. So I wouldn't take credit for any of it because I literally had to follow the stoves and pick and learn each one. And I got into airway and sleep apnea because again I went to just a regular spear occlusal course, and then at that in that course the faculty says any child that snores and grinds is not normal. And I said, wait a second, that's my child. And I went after class and I said, so what does that mean? And then he said, is she small in stature? Is she this, all the things that we always blamed because she wasn't needed enough, or if because she was in ballet and very rigorous, training and all of that. And all of it was, airway issues. And then it took me another 3 years going from one practitioner to another to figure out, okay, which way, because then they were like, okay, take the tonsils out, take the adenoids out. And I was like, well, that's my husband. And I was like, that didn't solve his problem. So I had to get into all the courses and learn, okay, this class doesn't, yes, it is hard when you're doing that. There's a lot of expense and a lot of time that goes in because and I think keeping gratitude throughout the whole time helped me because I was like, okay, maybe I don't have the answer now, but I learned this piece of it, and this piece led me to the next piece, and the person that takes you from A to Z, it's not necessarily going A to Z. The same person is not going to take you from A to Z. You can go from A to B and then B to Z. And that's exactly, I just follow the breadcrumbs, and the next course will pop up. And even today, I was talking with my hygienist, and she's getting trained in myofunctional therapy. And already her next course has popped up. I was like, I'm sorry, you have, you have got the bug. So now you're just following the breadcrumbs with me. But that's just, I think when we want to learn and we want to open, I believe that we invite that in to our lives. And so
What's your next breadcrumb? What's the next topic? I'm intrigued
I
as to
don't know if
what.
you want to know. So right now, it's just I'm really trying hard to. My team keeps telling me, "There's Safavi, can we do one thing at a time?" So I'm really trying not to put a lot of strain on them. But my next, I'm refining right now our airway protocols and TMJ protocol. But my next, step is going to be able to do infant frenectomies, and then eventually adult. By my passion are little ones, so I really want to learn
Yeah.
how to, um, you know, and I have done the training. I'm one of those is like hearing enough is not. I haven't heard that enough, so I really want to know how to do that well. I've done one training, but I still want to have it really well down. So, but that's my next step.
We wish you all the best with that one. I'm
Yes.
sure
Thank you
it's going
so
to
much.
be as much of a success as the others.
Mm.
Thank you. I appreciate it.
And I love the description of following the breadcrumbs. That feels so authentic and simple, like, just follow those breadcrumbs, and intuitively you'll know which breadcrumb comes next.
Absolutely. Yes, you can no, you could not have said that better. I really think being in that energy and really allowing the intuition and the messages to come through, it is valid. I mean, we all come with different religious backgrounds and with different things, but I do think being in that energy of wanting to do well and staying true to who you are and staying in that passion, it will lead you. You will hear, and the right book will fall in your lap. The right course will show up, and the right person. The all the mentors and the people who have helped me, I have just
Mhm.
come across them, and I'm so grateful. And I hope I can be that person for someone one day once I have figured out my path.
Mhm. I'm sure you are that person for many, but what I'm really curious about is you've brought up intuition so much, and it's obviously a big piece of who you are. Do you have a story of how maybe your intuition helped with a patient or helped you in your journey with where you are now?
Yes, and so uh, it's so many that I'm trying to bring my mind that I don't want to come across as a woo dentist, but and actually that was one of the parts that I struggled. Every coach that I would speak to at the beginning when I was trying to bring my brand in, they kept on saying you need to really highlight your hypnosis. You need to, and I was like, no, I don't want to come across that way as that dentist. Because your patients need to be ready, and I think once they're in my practice they love it and they're like, oh, we feel really good. And I even stopped using my nitrous because they didn't need it. However, in media and saying things out loud, not always, you can hit the message cannot be sent out correctly. But I came back from my first training with a hypnosis, and I remember just I had just came in from a small workshop, and I had just learned how to do just an induction, which is the first step of how to do the hypnosis for a patient. And this, I'm on my surgical rotation. We're doing and I had one faculty that he was trained in hypnosis. So I asked him, is that okay if I went to this course and I was all excited? And is that okay if I start using it? He's like, absolutely. Yes, start using it. And I was like, okay, so so we are. I suddenly this really tall because I was at UNC at a time, and this tall football player comes in, and he says, I have been in pain for 2 months, and I have not been able to come. And he was very anxious. So I thought, okay, if I have to, I'll use this, but I didn't say anything. So I put him on the bed. I give him anesthesia. I really thought I was going to lose him on anesthesia. So I give him anesthesia. Everything is fine. There are two um, dental assistant students helping. So they're just both are, we're all getting ready. I put this throat shield. I just put the gauze in. He starts hyperventilating and really getting anxious, trying to jump out of the chair. And I'm like, what? And the both students are looking at me like, you got to do something. And that's what I would say my intuition took over. And I just said, okay, I just know a relaxation technique. Would you like me to help you with that? And he said, yes. And I said, okay, look at my hand. And boom, he went in trance. And I just looked at him and I was like, there's no way. I just learned this technique. There's no way this worked. And sure enough, he went, it was calm, and I tapped his shoulder and I said, like, whenever the procedure is done, I will let you know. And sure enough, we took the tooth out, and then he came off and he hugged me afterwards and said, thank you so much for doing whatever relaxation thing you did for me. And then as he left, I'm still at awe. Like, okay, what just happened? And I went and asked the faculty that we did the workshop with, and I said, and he said, don't be surprised. You might do 10 more of this and this doesn't work. He was very, in fear. He was, for 2 months he was in pain. He wanted to receive the help. He was motivated. So then it worked. But that moment, I would say I just had to allow that intuition that, that worked to take over. And I have done that all my life, I would say. Yeah, I was one time in a line for at Walmart. I was returning something. This is many years ago. I had just got married and I was returning something. This woman comes over and taps on my shoulder, and I'm like, who knows me here? And this was just like some off, off highway Walmart that I usually don't go. And she taps on my shoulder, and then I turn around. There's this child, and she throws this child at me. She goes, "She just had a lifesaver." And then I hold hold this baby, and probably I've had like two or three like CPR classes at that time, and I held that child, and I was like, "God, don't let this child die in my arms." And I was like thinking, okay, do I turn this child this way? I wasn't a mom at that time. I was like, do I turn it this way? Do I do it this way? How old is this child? And this kid just looks up at me and swallows the lifesaver, goes, "Easy," and starts crying. I was like, okay, cry means air. And then the mom just grabs the child and runs out. And I'm just standing there. And I'm like, what just happened? And I really paid attention and I took my CPR every year instead of every other year. And so I do think there's a huge value because our jobs, there's a lot of, every patient is different. Patients don't disclose everything with us always, just allowing to be in that moment and being allowing that energy and the guidance to kick in. I think that serves us well.
Mhm. Those are good stories. And I'd love to follow up with, first I'd love to say yay for taking CPR once a year and listening to that intuition. That's pretty cool. But two, how about, has there been a time when you haven't listened to your intuition and hindsight, you're like, ugh.
Absolutely, yes. I wasn't a big, and I think probably you're very in tune, probably as you do this. Um, you have learned to pick on cues. That is probably, I would say, that was my pivotal moment. That
Mhm.
from that moment, I listened to the voices
Mhm.
of the guidance because I was in a bad accident. And I clearly remember, as I was, because I had forgotten my gown and I was going on a rotation and being the perfect person that the perfectionist that I was like, no. And I had heard, last time I was there when I forgot my gown, I heard the staff saying, "Oh my gosh, guys should have brought your gown and everything." And I was like, I was on this red light, and I said, "It's just gonna take me 2 seconds. I need to go grab the gown." And I clearly remember, just go to your rotation. It's okay. It doesn't matter, and I didn't, and I got in a really bad accident. So ever since then, I listen carefully. Yes,
Mhm.
absolutely. Absolutely. And it would have not been the end of the world. So what that I forgot? It's okay. I'm a student, I was late, etc. But all these pressures that again as young women we put on ourselves that I don't want to hear anybody saying anything negative or that I did less of. And yes, there are some things like the procedures and those things that are really important, but me not having a gown would not have been end of the world. Probably so. Telling my younger self that it would have been okay to just go straight and not grab that gown. So that was a big lesson for me.
Mhm.
You almost need some sort of prompt. Like if you haven't reached that point of knowing
Yes.
that you need to listen to your intuition, at that point in time, there needed to have been almost like a second question that said, at the end of today, will the having that gown actually have really made a difference to what you did?
Yes.
Mhm.
That it's like that an extra check, isn't it? But the intuition is so strong, you override it
Yes.
with an irrational side,
Mhm.
and yet
Exactly.
not listening to that. I mean, it's hearing you talk about all these experiences and the story of that guy with the hypnosis. I mean, is incredible. And from your personal experience, you've seen the healing power of hypnosis, as and how that reprograms thoughts and brings those benefits that are attached to it. How do you help your patients see that same transformative power for their own well-being? How does that work?
Absolutely. So I remember like at the beginning when well, first I started hypnosis with self-hypnosis. So I will listen to recordings. I started with guided imagery and then so I think just reframing and especially one of the recordings that I did had a lot of subliminal messages that I would hear. So I think that helped me. But then when I formally got trained to be able to help my patients, I would say that you know Dr. Handel was one of my really good mentors that he would say, you don't, because at the beginning you're so fixated on scripts. You're like, okay, I need to say the right things and I need to say this format and that format because there's so many books, so many scripts, and you listen to all these really well trained, hypnotherapists, and you're like, oh my gosh, that's incredible. But what it is just being in there, in tune with your patient. You're giving the patient what they actually need, but also just becoming hypnotic and being mindful of the words that you use are really the biggest part. So as my patients walk in, they're already in trance. So because they're scared, the white coat syndrome that they say, okay, I take advantage of that because if they're scared, then I can help because they're open. Versus if they go, that's the advantage we have with hypnosis versus a psychologist because they're like, what are you trying to get me to say? What are you trying? Versus for me, they're like, okay, help me. I'm in pain. So they're open already. So that's the advantage that we have as dentists to be able to do that. And then my words, I don't have to necessarily do um, formal hypnosis in order to be hypnotic. So that's what it is. So I'm very careful of my words. How many times we hear in medicine or different people say, well, you're going to have to learn to live with that. Or, my doctor said, yeah, it's going to take 6 months for that. So all of those are negative words. So then I switch that around.
Hmm.
I, as I give I mean, we know that the block, inferior block works 60% of the time, so I give that message. I expect that 60% instead of saying it might not work. I would be like, okay, the next thing you're going to feel is a tingling. This is what's going to, you're numb, your half of your tongue is numb. So I will give all those suggestions that I want to see so we can make the procedure smoother. And I will tell them I'm trained, for patients who are anxious. And we don't necessarily need nitrous. I can empower you to now learn how to be
Hmm.
comfortable in the chair. We don't need another external thing. You already have everything you have inside. You don't need to reach something else. So those are the words that I empower my patients that you don't need me. You're enough. You got everything you need. It's just you need to tap into it and so
I think,
that's
yeah, the most fascinating bit out of that for me was the fact that an anxious dental patient is more open and receptive to it than somebody who would be in a psychologist chair or a therapist chair or whatever. Because I would have, on the surface, you would think, oh, someone's anxious, they'll be like, it would be more difficult to get them with it. But yeah, that's so cool that it actually works because they're there
yeah.
because they want to be, they need it.
Yes. Because they are hyper, like they are so tense and so like focused. They're focused on every sound, every smell. That's why we get the bad rep of a bad smell in our office because everything is hyper
Hmm.
sensory for them. Every sound, they hate yeah, I mean, the feedbacks we
Hmm.
get, right? They hate the drill, they hate the smell, they hate all of that. And then, so why don't we turn it around? We give the nice music and we give the nice smell and all of that. So, because they are picking up on those things so greatly. So that's why I always get a compliment. Oh my gosh, your office smells so good. Yeah, so because they are smelling it louder than other times and I have the lavender right there. I have the blanket. I have, all the sensations are hyper. So the temperature, the sound, the smell, everything is hyper. So why don't we get on that wave and take advantage of that wave rather than seeing it as an
Did,
obstacle?
did you learn that? Did someone teach that to you? Or is that
Yes.
your experience that has shown that because they're in the dentist and they're hypersensitive to the smell of the dentist, you can give them another smell instead?
So those are, yeah, I can't take full credit, but yes, that's the thing that I would say. Once you allow that energy to come in, your creativity comes in.
Hmm.
So yes, the component that, yes, the senses are hyper are there, but then me replacing it with a smell that they like, yes, I came up with that and I put it right beside them. But so I would say it's a combination. So
Wow, you need to patent that or something. The
you're
Safavi
kind.
method of reverse replacement of smells and sensations in the dentist. It's special.
I would say like in dentistry, looking at it in dentistry specifically, yes.
Yeah.
And you both are very kind. You give me very lovely compliments. Thank you.
If you could just take that into every medical setting, I think, how many times have you gone into a medical setting where the colors are off and the smells are off and it does impact how you feel in that moment.
Absolutely. Absolutely. Because it
And
brings all the triggers out, you know.
yes, exactly. So I think that is really important. And I'd like to put a bookmark in it because what I'd like to really highlight here is a question about you said that when you're walking through this with a patient, you're empowering them, that they've got it all within them. Have you had feedback from patients afterwards that they take that out in the world and that has helped them out in the world?
So that's a really interesting, phenomena. It's because a lot of these, as I said, it becomes the way I talk with them, and it's because I'm just in a flow with them. They don't not necessarily know that unless I point it out, and I don't want to bring them out because hypnosis is focused attention. So I'm with them and walking, through things. I don't always point things like that out. They just say, I feel great when I come here. They don't not necessarily know why, but they just feel comfortable, with us.
Mhm.
And it has to be, and I have to give credit to my whole team because we talk about it always in the huddles and I walk them through it and everything. So they are trained. So from the moment that the patient talks over the phone, from the come front desk, my assistant. So they feel the hug throughout the whole time. So I would say that it has to be a team effort and all of us being in that. Um, and because I've had team members that haven't been able to do that and they're not the right fit. They don't,
Mhm.
feel comfortable doing all of that because they're like, why do I have to be so touchy-feely and be, talk about these things? But that is what it takes. And they are some patients that are already in tune. So they pick up on it and they're like, oh, I like what you did there. So again, we all have innate abilities. Some people are a little bit better at being in tune in different things. And I have been, I have had patients who have pointed that out. And like, oh, I like the way you did this or that. So depends on the patient, but I don't, especially on the anxious patients, I don't explain a lot. So we just go, as we go along. But it's transformational. Even their colors, the way they dress. I have had a patient that it's incredible. Now they're not even coming to me. They're going to a different patient near their house. But it was amazing that they came from the moment crying and being terrified of coming in to just changing their job and changing their boyfriend. It's like because it's incredible once you can do this on your own, you have all of the things you need, then you make different choices. It's incredible. I have seen it in my own life, and then when I see it in others I recognize it. So
Mhm.
Awesome. Oh, well, going back to that bookmark about colors and scents and all of that, you have something exciting coming up. You are creating a new location. So I bet there's a lot of very intentional thought going on in your head right now. Can you tell us about what the future holds for you in your practice?
absolutely. Because the practice we have, it's a new build. It was 5 years ago. I was like, there's no way I'm building again another practice. But I would say that just like what we said about decision making and what you mentioned about the being intentional, it's incredible that now that from the experiences and the lessons I learned from this build, we are putting a lot of intentions and a lot of changes, and then the team is involved and is saying we don't like this part or that part, and remember our patients like this, so it has really been helpful already having had our space here to say, okay, now that we're going in to this new space and knowing that this is going to be on holistic and sleep and everything all combined together, because again we were guided to, okay, separate your brand, and so all the things, and now we're going under one umbrella. Okay, this is a dental wellness, so now it's thinking of it differently and merging everything together, bringing it all together and being intentional in the space and how we design it. It has been truly a gift to be able to bring our experiences, and I'm sure even there we'll learn that we should have done it this way and that way, um, and go from there, and it will be fine. But we are very excited. We are going into a building um, that it's right now we are the first tenant of this large building that we're turning it into a medical. We want to be a medical dental facility to be able to bring all the people, hopefully, that are um, can take care of patients with airway issues and all the needs, movement, body work and acupuncture and holistic medicine and all the different things, along with safe removal of amalgam and and doing all the things that the patients need in order to be healthy, and people who want to have just their bread and butter regular dentistry also have a space there. So that's what we're creating.
Mhm.
So hopefully January 2026. Um, look out for our sign.
That sounds incredible. And I think that the holistic approach that you bring into it, the holistic and the well-being piece that you bring into it, I think there is a craving that people want that type of option. They want to know what is the root cause, what is, what could I do different, not just put a band-aid on things. And so I'm really excited to see how your space evolves, and excited to hear how many lives you intentionally transform in it. So
Well, thank you so much. Well, I am so grateful for the platform that both of you have created here to support, to highlight, to bring awareness for. We didn't have these as we were, going through all our training. So this is such a gift. I would have loved to listen to your podcast when I was in dental school or when I was trying to figure out my way. So thank you for creating this space and, you know, for allowing people to, come and encouraging other people to come and tell their stories and creating the space for everyone.
Right. Well, thank you for sharing your vulnerabilities and your wisdom and your intuition with us. I think that that is so important. The more we can bring community together and talk about this, like you said, Karen and I have talked about this many times. We didn't have anything like that when we were young, and so it's nice to be able to give back now and bring that to light. And if we can change one person's direction a little bit, I mean, that's worth it, right?
That's it. Yes, I have a good friend that always said we can just save one seashell, right? And throw that back. If I'm, my kids always make fun of me that I do the worst, acronyms and pronounce, but um, that if we can just save one, it would we would have done our job, right?
Mhm. That's right. Yeah. So I'm just going to highlight where people can find you. So right now, you're www.claremontdental.com, right?
Dot care.
.care, sorry. I saw that.
It's,
I just went .com.
it's okay.
.care.
That's one of the reasons. That's one of our lessons right there. We're doing .com for the new website. Yes, thank you.
You're welcome. And the new website, which is coming soon, is coloradodentalwellnesscenter.com.
That's correct. Yes,
Okay.
thank you so much.
Yes, we'll make sure that those links are in the show notes. And before we wrap up, is there, anything else that you wanted to say, or any one last message for our listeners today?
Well, first, I'm so grateful for being a guest here, and I would love if anybody has any questions, if I can answer anything. I really set my intentions as I come here to be truthful and honest, and try to give any wisdom or any experiences that I have. And you're so graceful and so talented that you were able to do that effortlessly. So thank you. But I will be happy to answer any questions that anytime anybody has. And Claremont Dental and Align Healing currently are our brands. And then Colorado Dental Wellness is going to be our future home. And I'm here to serve whatever way that I can to our community.
Well, you're a gem, and I'm so glad that we had the opportunity to have you on the podcast today. Listeners, I mean, I know in like the first 30 seconds there was already like 5 or 6 pearls. So reach out to Atousa if you have questions or you're curious. Don't forget to pivot. Remember, you are enough and you care. And we hope to see you on the next episode of the Mentor Podcast.
Thank you so much.
Thank you.
Thanks for listening, and subscribe for more holistic performance content.